everyone, this is Dr. Clark from the Center for Weight Loss Success, and this podcast is Doc Weight Loss. And today we're going to be talking to one of our certified personal trainers here at the Center for Weight Loss Success, Susan Hammock. And stay tuned, we'll be right back. Everyone, this is Dr. Clark from the Center for Weight Loss Success, and this is Doc Weight Loss. And as I mentioned, we're going to be talking to one of the personal trainers here about a very important part of a fitness plan, and that's stretching. Today we have Susan Hammock here, who's one of our certified personal trainers. If you're coming through the office or coming through the fitness center, you might be seeing her, and if you do, stop by and say hello. Susan, go ahead and let's just say hello to everyone.
Hi. Nice to be here.
All right, and today we're going to talk again about some stretching, an important part of a fitness plan. And we get questions all the time about fitness in general, but then there are some important questions just about stretching. So we're going to start out with some of the basics. Is why is it important to stretch?
It is important to stretch because a lot of people aren't aware that flexibility is a major part of being physically fit. I'm going to give you a rundown of some of the real big benefits of stretching. It does absolutely decrease any risk of injuries. You're going to be more flexible. If you're more flexible, you're going to be apt to less injure yourself. It decreases chronic muscle tension, which a lot of people complain of that. Decreases low back pain, a huge problem for almost 99% of my clients. Improves posture, you're going to stand taller, you're going to sit taller. Increases motor performance, it decreases stress, see a lot of that too. Relieves muscle soreness, say if you were working out with some weights, stretching will relieve that muscle soreness. Increases your mind and body connections. And it also, probably for the majority of the people that I see, it will improve their daily functional living. Activities such as gardening, housework, any number of things that you do around the house, it's going to be a lot easier.
All right, so there's a lot of important components to stretching, and sometimes people have questions about timing. So when is some of the best time to actually work on stretching and flexibility?
Well, before you stretch, you should warm up the muscles. You don't want to stretch cold muscles. You could, incur injury that way. So a little brief warm-up, say a walk, or maybe just on the elliptical or one of the stationary bikes would do that. Stretching is the workout, too, that you can do this every day with no risk of overdoing it. In fact, it's ideal if you stretch 5 to 7 days a week, even if it's like a 10-minute stretch. But that is a great thing to incorporate in your daily schedule.
So as far as kind of stretching, I'm one of those people, I'm very inflexible, and it kind of drives me crazy, but I've never really taken as much time as I should, and I understand I should. But really, how long should one work on stretching?
Well, the amount of time that you should actually hold a stretch is anywhere between maybe even just 15 to 30 seconds. Or in other words, using your breath, which is very important, maybe take 3 to 5 really deep breaths in that stretch you're doing. It's important not to hold your breath. I mean, that's extremely important. And a lot of people are guilty of that too. They'll try to stretch and they'll just lock up their breath. So that's extremely important that you take these slow and deep breaths. On your exhales, if you can remember this, on your exhale, try to go a little deeper, a little longer, allowing that range of motion to increase. And do that with each breath.
All right, now there are different types of stretching, and so walk us through kind of what are some of the types of stretching and the benefits or possible detriments of some of the types of stretching there.
Well, there are actually 2 basic types of stretching. Ballistic, which is more of your bouncing or pulsing, rapid pulses into your stretches, that is not recommended for really the entire population, because that could incur muscle tears if you're way too abrupt, I would say, in those pulses or those bounces. So be very aware of that. But when you're doing the static stretching, which is the other type of stretching, that's the safest, and to me, my opinion, the most effective. Low intensity, long duration of the muscle lengthening, and that's where your breath comes in again. You want to use that breath, and much lower risk of any injury. And it provides a lot more of that relief to muscle soreness. So those two types, ballistic, okay if you're comfortable with that. Not recommended for everybody, but static, holding for long periods of time, like I said, 15 to 30 seconds. You don't have to be there forever, but use your breath and enjoy the stretch.
All right, that was very good. Stretching, it should be a big part of anyone's fitness plan. I know I should incorporate it a whole lot more. Now, we've got a lot more information for you, and if you're interested in more information specifically on stretching, we've got 12 stretch videos on our YouTube channel. It's Doc Weight Loss. So go to our YouTube channel. It's a series of 12 videos that demonstrate stretches on all the major muscle groups. You can get a lot of good information from that. But if you're looking at for just more useful information as far as weight loss and overall health, go to our Losing Weight USA, our website there, which is www.losingweightUSA.com. Well, this is Dr. Clark. I'm going to be signing off from the Center for Weight Loss Success. This is Doc Weight Loss. Remember, it's your life. Make it a healthy one. Have a good day, everyone. Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success, and this is an episode of Weight Loss Surgery Success. On today's episode, we're going to be talking about B vitamins, injections versus pills. Can they be helpful for your weight loss? Stay tuned. We'll be right back.